Shalom and welcome to 2 Minutes of Torah. This year is entitled Daf Yomi The Gemara talks about birth control practices that they had during the times of the Gemara. The obvious question is, what's the halacha regarding birth control? So a simple overview is there's two basic topics, sugyot here, that need to be looked into. One is regarding Miniat Harayon, birth control. Number one is the mitzvah say of puravu. One has a mitzvah say to have children, right, a boy and a girl, then midvarbanan. There's a mitzvah to continue to have children. And the second question is, besides that mitzvah, there's nisra shechval zera levatala, of wasting one's seed. So both issues have to be dealt with when talking about miniat harayon. This, of course, is a very, very important topic, a delicate topic. And Rav Moshe, he discussed this dozens and dozens of times through his Ketuvoth. He always makes it clear that each person must go to a posek, cannot rely on Rav Moshe's tshuvas, any other tshuvas. They have to discuss the case with the posek. So any discussion, of course, is just a general discussion that we'll mention, but halacha l'mayis, practical halacha, always one has to go to a posek to discuss it. So you have the mitzvah say, so there is a chiyuv, the right to have a boy and a girl. After one fulfills the chiyuv, the right to have a boy and a girl, then there are some say it's a chiyuv d'rabanan, some say it's a mitzvah d'rabanan to continue to have children. And the person must first see if there's a heter to hold off, postpone the mitzvah, whether he has a boy or a girl, or a boy and a girl. So if he does that, he has a boy and a girl already, then the chiyuv, the man's chiyuv is d'rabanan to continue, or the mitzvah d'rabanan to continue. If he doesn't have a boy and a girl yet, then he still has chiyuv d'oraita. So the posek would have to first deal with, is there a heter to hold off and suspend this mitzvah aseh? It could be the woman is sick, could be the man is sick, and it could be he has no income and there's no way for him to go ahead and support the family. There's other different factors that one must take into account and discuss with the posek regarding the chiyuv d'oraita, or the chiyuv or the mitzvah midrabanan, and when it may be held off, suspended. So that's number one. And the second topic that must be looked into is once he has a heter to hold off with the mitzvah of having children, then how practically can he stop the fulfillment of puravu? And of course, you have the issue of shechva zera levatala, where if the seed is wasted, that's an issue. The most extreme form of shechva levatala would be where a person would use, the man would use a protection on himself. So then the zera is in no way even entering the woman's body. So then that would certainly be a violation of almost according to everyone of shechva zera levatala. And on the other extreme, if a woman takes a pill, so then everything is going in a regular manner. The zera is entering the woman, and it's just her body has been taught, so to speak, not to react, not to become pregnant from that. So many would say that that's not considered to be shechva zera levatala. And if there's a heter to not have mitzvah of puravu, then that might be the best option, assuming the woman is not going to have bleeding from the pill. And then in the middle, of course, you have a lot of different possibilities, IUD, the spermicide, and other things. And that pretty much all ranges from the most severe case of man using protection, and then to the other extreme, the pill, and then you have a whole bunch of different cases in the middle. So that's just an overview of the two issues involved. The miniat harayon that the Gemara discusses: one, holding off from puravu, and number two, avoiding shechva zera levatala. It's just an overview. Of course, the person must deal with the posek. In this case, in all halachot, but especially this case, is a very delicate one. Shalom.